we just thought we would try something different, because in order to have a dialogue about anything, I think the right energy, right environment, right setup are all important. And the dialogue today that I think is very important to have is, as we look around, we see countries getting richer, but at the same time, with affluence comes other problems. So I think in India, who would have thought the rise of obesity is faster than the rise of GDP, right? If you look at the percentage of unfit. So you have to wonder, where are we going in this country of contrast on creating health and fitness as a important um, index. And in fact, the Office of Commissioner in India, uh, by their measure, lifestyle diseases are the biggest cause of deaths in India. And I'm sure all of us can anecdotally think about a generation ago, how many times did we hear of a 35-year-old or so dying of heart attack? And today, it's very staggering numbers. So to give you just statistics, in India, every 33 seconds, apparently a person dies of heart attack. And hence the question of what is really fitness. And if you say you're fit, are you really physically fit? Are you mentally fit? And how do we make a billion people fit? And hence this event today about billion fit. There is, of course, a age-old saying, health is wealth. And I'm sure that's as relevant today as it was uh, for centuries. However, today, though, health is wealth in the sense that it has become a very big business. India's healthcare sector is estimated to be worth 160 billion. Is estimated today at 160 billion and growing at double digits. Even in medical innovations, we have a history, like all great civilizations, whether that's the Egyptians, the Greeks, the Romans. There was a lot that was actually existential well before the modern medicine got invented. And Sushruta, which is supposedly the oldest document on medical surgery, was created almost in 600 BC. Almost that's close to 3,000 years ago. One of the first medical documents that we can look at that spoke about surgery. So, but despite our glorious, apparently, history, today, though, India's healthcare, we all know, is in a crisis. And according to some numbers, India ranks 154 out of 198 countries on healthcare index. And that's behind Sri Lanka and Bhutan, and states like Bihar and Uttar Pradesh actually have worse rating than some sub-Saharan African nations. Infant mortality in India at 42 is worse than Madagascar and Kenya. So hence it's time we talk about this topic. But we want to actually spend today also time on prevention. But before we go to that, India's healthcare spending is about 1.2% of our GDP, as compared to 8.3% in US. Not that the index of health is about how much money you spend on it, but at least it's an indicator of how seriously the government invests into its citizens' health. And in India, the out-of-pocket expense is the highest overall in healthcare spending in the world. So average Indian spends 62% of their care as out-of-pocket expense, as opposed to, say, 11% in a country like US. Of course, the root of that is about how many people are insured. And in India, that number is a abysmal 17%, and even that is a misleading number because it's not a true indicator of how many people have comprehensive health coverage. So poor infrastructure, shortage of skilled workers continue to dog healthcare for our country. And as you can see, we have far few physicians and far few nurses, and very low numbers compared to any other developed country. So clearly, that we have to change something is not new news. And the question is how and what. And we hope today, as we go on, we have some ideas we can take with us on this topic. So, but not all is bad. I think we should start a morning on positive news. So, if we look at what progress we have made, India's infant mortality just about 40 years back was 165 to 1,000, and today that's fallen dramatically to 38 to 1,000. So that's progress. Life expectancy has increased from 41 to 68 in just the last 40 years. And infectious diseases, as you all know, like smallpox, rubella, have been eradicated in India. So has India been declared free of polio. So the above examples demonstrate that if we have the will and the perseverance required to tackle a tough and hard problem, we'll find solutions to solve it. But it has to be at a societal and systemic level for any difficult problem to be solved. So a lot needs to be done in making India a billion fit nation. And why is health so important, right? And I thought when I see the famous David of Michelangelo, what did it really represent? Of course, it represents youth and beauty, but I also think it was just the glory of somebody who's healthy and the glow of being disease free, and it captured people's imagination, right? So, as a civilization, I think for eons, health is a quest, it's the holy grail. But as we cure old diseases, we seem to somehow create new ones also. The dreaded plague pandemic, uh, you know, uh, aptly called the Black Death, actually wiped out one third of the world's population. Staggering to imagine. That would mean today some one disease killing 2.5 billion people. It's hard to imagine that. Um, but if we look at it, at the end of it, it had to come from the solution, had to come from preventive measures that created better hygienic conditions. So rather than look for necessarily a cure for the disease. And, likewise, things like typhoid, cholera, tuberculosis, until the advent of penicillin in 1928 and antibiotics just a little while later, were diseases that invariably caused death. Of course, the very same antibiotics today we all know are creating superbugs in the hospitals, and we don't know what the cure for that is. So, clearly epidemics like plague could have been prevented by having better living conditions. So the question is, should we focus only on curative health, or should we focus also on prevention and becoming healthy and fit as a nation, as a world, as a civilization? So, preventive care for an ideal man or women, how much of this should be a conversation and emphasized? The reason is because we know that things like heart attacks or diabetes, obesity, lifestyle diseases can be considerably reduced through preventive care. And they're often simple enough preventive cares, right, that can do this. If you look at cancer research alone, I'm not a doctor, by the way, and most of you know that. But if you look at cancer research alone, we spent $100 billion, but not even 5% of it was allocated towards research on prevention. We're not talking about pharmacy, drugs, doctors, hospitals. We're just talking about research. So less than 5% was allocated to even research prevention. If you look at India's healthcare spending, more than 90% of government's healthcare spending is allocated to curative health, but not for prevention. So less than, I think, 8% or something India spent on health is on preventive measures, and those are vaccines and things like that. So clearly, we lack enough emphasis on creating awareness, and of that allocation for prevention, less than 1% is around education, information, counseling, and so on and so forth. So, an early detection spend is even worse. It's 0.1% of the total spend on anything that constitutes early detection. So, one of the things that I think is important is talking about preventive care. Uh, could that also, or should that also be an important missing piece in solving the healthcare puzzle? And I'm saying all this from our perspective of really looking at the healthcare opportunity over the next 10 years. So this is neither a discourse on healthcare nor medicine. This is really about wherein lies opportunity in India to make an impact, to make a difference, and hence for entrepreneurs to create solutions and for us to make investments. So let's be clear, it's really even from that lens that I'm speaking than a social or a moral focus, which also it should be, but here my conversation still continues to be from the perspective of where is the opportunity for us to look at things, and we'll come to that in a minute. And we all know that prevention has, or health itself has sound economic reasoning also. In fact, a WHO study shows that between 1900s and 1700s and 1900s, the small country we all know as the small island country of England, Britain, gained a full 30% per capita increase or growth attributed to health and nutrition alone in the improved life expectancy and so on and so forth. So, um, uh, so as we continue to look at this opportunity, I think there's a role to play in creating billion fit and including prevention as an important measure of that. And this role is, of course, lies with the government, but I think equally the opportunity exists for entrepreneurs, healthcare professionals, and hopefully venture capitalists to make it a reality. So, can tech solve any of these healthcare problems? Because let's come back to it. This is also about tech for us. So, because at Kalari, at least, we don't necessarily look at the services and the caregiving because that's not in the scope of what we look at. We normally look at tech solutions. How many of you are wearing a fitness device today or have ever had one? Okay, more than 50%. In 2016 alone, 6.2 billion has poured into simply health tech startups globally, obviously not just in India. And I think tech firms are trying to redefine prevention, redefine diagnostics, redefine drug discovery, and so on and so forth. Um, and of course, today we are going to talk about cybersecurity because all of this comes back to data and how data gets handled. And innovation is abounding everywhere, right? So I thought, I'm sure some of you have seen this in the past. This is the 3D printed ear, but this notion of 3D printed organs sounds like some Star Trek or something. Doesn't seem that far off, and it's growing faster, and there is a big expected market on on-demand organ transplants that are actually printed and as far-fetched even as a 3D printed humanoid robot. So, don't know when it will happen, but these things are happening faster than any of us would have thought. And same with surgery, right? Robotic surgery already is here, real, and first time human trials are actually underway right now on doing these keyhole surgeries and so on and so forth. So, the expectation on assisted surgeries, robotics alone is expected to be a 20 billion opportunity. So these are all tech, not necessarily in the conventional way we think of tech, but definitely tech and medicine are getting married and deeper and deeper, and not divorced anytime soon. And investors are actually active in this, right? um, from monitoring to healthcare records to security to personalized diagnostic, drug discovery, online platforms, productivity. I mean, you name it. There has been in the last 5 years 11 billion plus of investments that have been poured into healthcare startups, and it's not uncommon for medical professionals, bio experts, doctors to now get hired into tech startups, right? Who would have thought? And I do think that as we rush into this, uh, some caution around the typical, what should I say, mindset of tech industry, which is crash and burn, grow fast, grow big. I do think some of that moderation into the VC community will become important, because this is not simply tech, this is about lives. If you have an app that crashes and burns, that's fine. And we all know what happened with, what was it, Thyrocare? No, not Thyrocare. What was the big flame out? Yeah, Theranos. We know the big flame out that happened. So I think it's important that we also understand that these are have a certain gestation for growth, and we are tuned to create. I don't know if that means funds life should be longer, or whatever those answers are. I think as we continue to think about health tech, those become important. Um, Now, just switching gears to fitness and wellness, this is another trend globally. Investors continue to be funding, whether that's physical fitness, mental fitness. Tremendous amount of capital has gone into it. However, if you look at the digital health share globally, India is there, so that's great, but bulk of it is not innovation coming out of India. Less than 5% of the digital health investments have really, happened in India. And can that change? And that's one of the reasons to have these dialogues, to think through and see, hey, what could happen? How could this change? Um, so slowly but surely, Indian companies are getting funded in this space. Two companies that Kalari has funded, Afford Plan and CureFit, and you've seen CureFit everywhere here. You'll know more about them soon, and True Weight also. I think these are some of the early companies that we are seeing focusing on health tech opportunity, and there are some more. So I think this is a great sign, and most of the companies today, though, are still solving India's problems, and very few are solving global problems. And I'm not suggesting we should solve global problems, but I'm optimistic and confident that out of India there'll be more companies that solve not only India's problems but also global problems. So then, just kind of to wrap up, I think that today we are poised to have very interesting discussions and talks on several topics, from cybersecurity to focusing on personal wellness to hospitals of tomorrow. And we also have a specially designed fitness wellness experience from CureFit, who's a co-partner for this event in hosting today's sessions. And I'm glad, some of you at least have come in active way, but even those that haven't, I would highly encourage you. This is meant to be fun. This is meant to get to know each other. And, the CureFit folks will tell you more about it, but there are various sessions, 10-minute sessions. So all of us, I know, are fit enough to do 10-minute sessions. And I would encourage all of you to at least try out the planned activities, even if you are or not wearing activewear. And also we wanted to kind of walk the talk. So today you will only get healthy food here. There's a McDonald's downstairs. So, but if you don't tell us, we won't notice. But we have a celebrated chef, Manu Chandra, who's, I think, designed a very interesting healthy menu for lunch. And then you have lots of things How many of you had CureFit's oatmeal chia seed breakfast? Yeah, great. Did you like it? Yeah, easy to make at home. Or actually, you could just order it from CureFit. I'd highly recommend that. So, so you know, but there's other companies that have set up some showcases, and they have freebies to give out. Young companies, so please stop by, encourage, understand what they're working on, and let's have a great fun day together today.